must constantly look at things in a different way.
The Healthcare Education Transformation Podcast was created by two physical therapists out of the desire to learn more about the different educational roles in physical therapy and healthcare, and how healthcare education works by talking with educational leaders and people with different perspectives within physical therapy and across interdisciplinary lines on how education can be improved to disrupt the status quo of healthcare education. This is our journey, and thanks for listening. Are you a third-year physical therapy student that excels on tests when you have study guides, checklists, and deadlines? With all of the information available about how to prepare for the NPTE, it's easy to get disorganized and not feel prepared going into the big day. NPTE Prep Success is an online course that provides PT students easy-to-use study guides and step-by-step guidance through the NPTE preparation. To learn more, visit kylericeprep.com. Thank you again all for your continued support, and now for the show.
Hey, everybody, and welcome to another episode of the Healthcare Education Transformation Podcast. I'm your host, Brandon Powen, and today I am actually joined by a very, very special guest to go over the Sports Specialty Council of the ABPTS. As today, I am thrilled to welcome Dr. Michael Fink, who has been extremely involved from the practice, education, and professional avenues of physical therapy. Now, for those of you who aren't aware, Dr. Fink is currently the chair of the Sports Specialty Council of ABPTS, and he was the item bank coordinator from 2015 to 2018, and was a member of the ABPTS Board of Directors from 2009 to 2013. And you know, it's funny when I look back on this, I actually never knew that Mike was actually involved with this, because how I actually first heard of him was actually through MedBridge, through his differential diagnosis courses and series on there. So it wasn't until later that I learned that he was a part of ABPTS, which I thought was really cool. Well, Mike, you know, I appreciate all that you've done, you know, throughout your career and all that you are continuing to do. So I want to just say, first and foremost, thank you for what you've done, and thank you so much for joining me this evening to chat about this. We're excited to have you.
I'm excited to be here too, Brandon. And I'll tell you, it was really nice to be able to see you in Jacksonville, Florida at ELC back in the fall. So we finally got to meet face to face rather than just over the, online or over the phone. So I'm glad to be here. Glad to have this conversation.
Well, I mean, it's likewise, right back at you, Mike. And, before we kind of dive into talking about the Sports Specialty Council and ABPTS and the exam, I'm always curious, because doing this podcast, I've always learned that there are so many different ways that people get into teaching, academia, and kind of within these avenues of the professional association. So I've got to ask, how did you get involved within education, and how did that kind of lead you to where you are now as the chair of the Sports Specialty Council? Like, what's your story?
Yeah, it's kind of by accident, like most good stories. Graduated from PT school and then joined the Air Force and was a military PT for 10 years. But it was really my Air Force journey, having been deployed, and then I was at a couple of the service academies, West Point being the one that I did my sports medicine residency, and I covered all different sports teams there, from sprint football to boxing to grappling, and then continually working with our tactical athletes. That kind of really spurred on my interest in sports medicine. So after my sports residency, I went to the Air Force Academy and ran the cadet clinic out there for a couple of years out in Colorado Springs, got to spend some time at the Olympic Training Center as well. And while I was at there, I took my SCS, because that's the expectation of a graduate from a sports medicine residency at West Point. And after that, I had all this knowledge, and I was encouraged to impart that upon the folks that I worked with and the greater community. That then I started to become an item writer. So in 2007 is when I applied to become an item writer for sports. Once they got their hooks into me, they didn't let go, and I just loved it ever since. And so I just kind of moved up that ladder from being a SACE 1 member to SACE 2, and then moved up to being a CCE, and then finally the item review coordinator, which is overtop the CCEs. And I should mention, the CCE stands for Committee of Content Experts. They're sort of the smaller group of people that help review questions for the SACE 1 and SACE 2 item writers. And then after being the IRC, which is one of the council positions, then I just kind of conveyor belted up to the chair position. And sort of while I was doing all this, on the other side, I was able to, from 2009 to 2013, be on the American Board of Physical Therapy Specialties as my orthopedic hat. So I got to be under my OCS, not my SCS. So really at this point, I've almost been at every echelon within the item development and test development phase. So I really enjoy it, and we'll have a great conversation tonight talking about all the different facets of it.
Absolutely. And, it's been interesting. We had Bob Sellen on not too long ago to kind of talk about just ABPTS and a little bit about this in general. But I'm excited today because now we're going to kind of dive in a little bit more into one subsection of it rather than just more of a general discussion on ABPTS. But, Mike, I recognize that there are some people out there that perhaps don't know a little bit about ABPTS and kind of how it operates here. So to kind of dive in a little bit, what specifically does the ABPTS Sports Council do, and how does all the members of this council work together to really achieve the mission that they're trying to do? Like, how does it work?
So really the major role of the American Board of Physical Therapy Specialties is to create the board certification exams. So right now there's currently 9 board certification exams, sports being one of them. And so they really oversee all facets of it, from item generation to validating the exam to determining what the pass score is, or what we sometimes call the cut score is, and then determining how individuals that do pass the exam, what things they need to do in order to stay certified as a board certification. So it really kind of oversees the whole process. So they're the governing body. And being the governing body, it's represented by members of each specialty. And then kind of under the ABPTS, you're going to have the different councils of those 9 board certification entities. And most councils have around 3 to 4 to sometimes 5 council members. So that's sort of the structure. That's how it's set up. So in the sports council, there's a chair of the council that kind of oversees all the group work. And right now I hold that position, and that changes from year to year or every 2 years, depending on when people cycle in and cycle out. Also on the sports council is an item review coordinator. And that item review coordinator is the person that receives all the questions that have been revised and edited by the 5-member Committee on Content Experts. And those Committee on Content Experts receive questions that are generated from the SACE 1 and SACE 2 item writers. And so it kind of goes on that sort of conveyor belt. And then there's also within the Sports Council, there's a MOSC liaison, which is the Maintenance of Specialization Certification. So that's kind of what folks that have been certified, they will have to do things every 3 years out of a 10-year cycle. And so that's the person that sort of is coordinating all that. And then at least in sports, we have another person that coordinates all of our acute management of injury and illness stuff, which used to be called emergency medical responder coursework. And so that's sort of our little silos, but we all work together. Now, how we interface with ABPTS, and there are 3 meetings a year. We always meet at CSM, and then we also will meet in the spring, usually May timeframe, and then again in the fall. And so that's the chance where the chair, myself, at this time, will actually interface with the ABPTS. We can tell them things that are going well with the council, things that we may need their assistance with, things that we may need clarification from them in. And so that is how we interface with the council. We also, at those CSM meetings, often will have meetings with the American Academy of Sports Physical Therapy. Now, that American Academy of Sports Physical Therapy used to be called the Sports Physical Therapy Section, the SPTS. And so then we can start talking with them and seeing what discussions need to happen so that our sports members of the ABTA are informed and that there's clarification for them on different things like that. So it's usually at these face-to-face meetings. And then in between, we are really open to communication. So sometimes we receive direct communication from members or sports certified specialists or hopefuls or potential sports certified specialists. We also talk a little bit with the director of ABPTS when there's also policy or procedural questions that we have. So that's kind of how we operate. It's a structure, but we sort of loosely operate within that structure, and communication flows pretty freely.
So, Mike, I'm curious because, being in your position within the sports council and from someone on the outside, I'm always kind of curious, what are the barriers that you guys notice and from your position when it comes to kind of creating and formulating the exam, apart from all the other things that you had mentioned that you guys are working on?
So one of the biggest things is time, and more of a lack of time. And I know everybody says they're busy and time is always an issue for a lot of people, but really we are a volunteer organization. So folks that are writing the questions, folks that are reviewing the questions, folks that are editing the questions, all those people have full-time jobs, and they're usually demanding jobs. And in a place like sports, sports clinicians often work on the weekends. They often work in the evenings. That's when teams play. That's when teams travel. And so I think one of the biggest difficulties, at least for sports, and I'm sure it's probably true for a lot of the other councils, is having members that are just really busy. They're doing great things in our profession, and just they have some difficulty allocating some time to do this. And when it's volunteer work and there's other things that need to be done for, your paycheck or for different things, sometimes it can be a little bit of a struggle. So time is one thing. The other thing that we sort of struggle with globally within the sports specialty world is the practice acts from different states. So many states, their practice acts are really silent as far as what a physical therapist with a sports certification can and cannot do. And so there's already the athletic training community that does venue coverage and things like that. And so many of our sports therapists will ask us, can I do this role that is historically done by an athletic trainer? And our response is, you really have to delve into the practice act. And we say that, but we also know when they do, they often don't find anything. And so the thought is, I guess the different states will say, hey, if you're working outside your scope of practice, I guess we'll know it when we see it. But that doesn't do a lot for our sports folks that want some clarity as far as what they can and cannot do, in regards to sideline coverage and those kind of things. And so our response is, you always have to remember to be working in the capacity and in the scope of a licensed physical therapist. If you start to work in the scope of a different profession like athletic training, then you're working outside of the scope of our practice and our purview. But that's a struggle that we do get quite often.
No, that makes sense. And I honestly hadn't even thought about that until you had mentioned that. And, Mike, I realized I should have asked this a little bit beforehand because, of course, knowing that, of course, there's a lot of forces that go into, all these governing bodies and stuff. But I'm just kind of curious, is there anything from like a state law, national law, accreditation standpoint that ABPTS in the exam that you guys have to meet in order to kind of have the exam be what it is?
Well, there are always things that are trying to be injected into the exam. And really, there has to be a majority of states that allow this practice. One of the ones that come to mind is like dry needling. Dry needling is allowed in many states. Some states it's coming under fire, and some states, like my home state of Pennsylvania, it's not allowed at all. So when these kind of things try to get into an exam, we have to look to say, well, can the majority of folks perform this activity? And if the answer is no, then we really have to pull that out and withhold that from the exam. If the answer is yes, then those things that we can put in the exam. Because in all honesty, there are some things on the exam that some sports certified specialists in some states just are not allowed to perform. And so that's sort of the reality of looking at the different state laws when it comes to that. The other thing that we look at the exam is what would be considered entry-level practice and what's considered true post-professional or a board certification level of practice. And that's sometimes also a little bit difficult because what one camp thinks should be post-professional and it should not be in the purview of an entry-level DPT student. The other side thinks, no, that should be well within the purview, especially as we're pushing our profession forward. So those are things that we look at there.
No, that makes sense. And, Mike, let's kind of dive into the ultimate meat question here, because I think this is going to answer a lot of stuff here. From your standpoint, would you mind explaining how the SCS exam is developed from the beginning, from like how it's formulated, questions, how it's all kind of regulated and such, just to kind of give some overview into this exact process?
It all starts with a practice analysis. A practice analysis is a very lengthy survey that is sent out to both board certified specialists and non-board certified specialists. And we ask almost everything under the sun in that practice analysis. Really, the practice analysis is looking at knowledge, skills, and abilities, which we call KSAs. And in the whole litany of those knowledge, skills, and abilities, we want to know how frequently specialists and non-specialists use those knowledge, skills, and abilities, how important they feel that those activities are in the context of sports, physical therapy, and then the level of judgment needed within those knowledge and skills and abilities. So the higher the judgment, the more one would think that this would be a specialist type of item. And so we look at that whole practice analysis as a national survey. We often struggle with a good response rate because it is so long. Sometimes it has been broken up into different parts, so no one person has to take the whole thing, and sometimes it can take up to an hour to take. But there are a lot of invested folks in the sports world that say, you know what, I know this is a long survey, but it's worthwhile. And so I want to really be able to tell the Sports Specialty Council and the ABPTS what current practice looks like, at least in my world. And so we get those collected from all over the country. And then we collect all the results from this, and we look at what things are done frequently versus non-frequently, what things are deemed important and non-important, and what things level of judgments occur, and it's on a whole Likert scale. From there, we boil down that data and we create something called the description of specialty practice. The description of specialty practice is the blueprint for the exam. And so our current description of specialty practice has 7 areas, and those 7 areas cover anything from acute management of injury and illness to professional roles to rehab and recovery, and that all comes right from the practice analysis. And then that description of specialty practice is published. It is available on the ABPTS website. It's what a lot of people go to when they're seeking out to sit for the exam, to give them a framework for what to expect on the exam. But that blueprint on the DSP also informs what questions are written and how many of each. So when we have our item writers in front of us, we have essentially the DSP, and we say these are the categories that we would like questions written in. And we know from the DSP what percentage of the exam should have this amount of questions. And so we tailor the number of questions generated from our item writers in accordance with the blueprint, with the exam. And that's how we sort of build that question up. And then, as I told you, mentioned before, that the questions then go up through the editing process. So from the SACE folks to the committee of content experts up to the item review coordinator.
So, given how that the description of specialty practice and how that's kind of formulated from getting the responses from so many different stakeholders, how do we balance the responses we're getting from practice with kind of the evidence as it's emerging?
Great question. So it's kind of, how do we weed out the faddish things from the evidence-based things? And there's a lot of faddish things within our physical therapy practice. And so how we do that is within that team that develops the description of specialty practice, we have content matter experts, subject matter experts, I guess if it were SMEs. And so subject matter experts are the ones that know the field, but also know the literature really well. And so as we go through that and we say, oh, wow, this one thing is deemed really important, it's done really frequently, and people think it just takes a lot of judgment to do it well. And they bring it back to the subject matter experts and they say, yeah, I know it's done, but this isn't really founded on a lot of evidence. So they'll either pull that out or they'll dilute it a little bit in some way that it doesn't have so much weight.
Gotcha. And, just to kind of give a little follow-up, you of course mentioned that those subject matter experts for criteria for eligibility for that kind of a role have to be well-versed in the research. How do you guys measure that? How do you find someone like that? Like, how do you objectively find someone like that?
So one of the ways that we can find people is through the item writing pathway. And if I can, for full disclosure, at least for the DSP, I was one of the subject matter experts back in 2013 when we did our most recent DSP. And the thought there is that if you've seen so many questions, you're editing so many questions, that's a way of just sort of studying by default. And so not only do I practice in sports medicine, but I also have seen a zillion questions, and those questions often will allow me to delve into the research to see if those questions are written correctly, if the if the answer options are correct, if the distractors are correct. And so by doing that, it's like a continual studying of that. And so I felt like when I started doing item writing, my residency program really never ended. Like I just was in that student mindset. Now being in academia, which is where I am now at Lebanon Valley College, I continue to invest into the research. So it's a little bit of just, you can select one or two or three people. That's usually the most amount of people that are on these DSPs, the subject matter experts. You can usually kind of look at their history and their exposure to research, and sometimes they're kind of easier to find than you might think.
Mike, you had kind of mentioned some of those aspects of here, and we had actually, when we talked with Nancy and Rich from FSBPT in the past regarding the NPTE and kind of learning more about their item writing process for the NPTE, I'm just kind of curious I know you had mentioned, of course, the item writing and stuff, but if we could kind of dive in specifically to kind of like an item writer for the SCS 101 here, what are some of the criteria and some of the things that a question has to be able to pass in order to be used on the exam?
There's a couple different ways. Usually our item writers are folks that have recently passed the SCS, and so they have an interest or invested. They're often coming out of residency, or they're in academia and teaching, or they're out in the community as clinicians, and they're just invested in seeing sports really be propagated forward. So we get them kind of under one roof. They decide to be an item writer, and then we ask them to either write in an area of interest and an area of expertise, and often those two are connected, or in an area of need. And so that's kind of how the first thing goes about, where they write in those areas. And then really we have a half-day item writing workshop at CSM, and that's where we teach them the elements of a good item writing skill and good question development. Folks that are in academia actually tend to usually have this skill a lot because they're writing exams, and if they aren't, they usually come out of the item writing workshops with the skill, so they go back to the classroom and can write better exams. But we talk about things like don't have double negatives, the things like longest answer can be sometimes the most technical answer, so we try to stay away from things that are giveaways, because you can, if you create a question, you can actually create a question such that somebody who has no knowledge of the content could guess it well just by how it's constructed. And so we go over a lot of those fatal flaws. Ask questions in a positive, not a double negative, and maybe I've already said that, but just different things like that. Don't always have your last answer option be the last one you could think of because it wasn't absolutely right. The first answer is always the one that's right. So reordering them. And at least for the SCS, the exam is written such that there's vignettes or kind of little small stories that precede your actual question, which then precede your actual answer choices. And so we ask that the questions be clear, concise, so no more words than necessary, and not divulge too much information that it's a layup for the person taking the exam, but not too little information that they can't make sense of what this clinical picture looks like. And then honestly, as it moves up through the chain and people do different edits and reviews and they put the rationales behind it and their comments behind it, then we ultimately have to beta test those questions. And so on every exam, there's questions that are being tested. And then we look at those psychometrics after the exam's been taken. So they may not be scored questions, but they're just tested questions. And based off those psychometrics, we can say, yep, this is a good question to really keep in the item bank and use for maybe possible future exams, or no, this did not perform well. Either rewrite it and try to stick it back in there for another beta test, or we just need to pull it all together and just call it a day on that question.
And Mike, correct me if I'm wrong, but when you have to give rationale for, answer choices for a question, you kind of have to prove with the references of kind of why that's right, but also being able to prove distinctly why the other ones are wrong. Is that correct as well?
That is correct. You can't just say that this answer is correct by X, Y, and Z and say the other three are wrong or the other four are wrong because it's not the right answer. So no, you have to have specific rationales for each. Now there is one part that I want to kind of make a clarification on. This might have been your next question, Brandon, but was textbook versus journals. And there's a misconception that all of our questions on the certification exam have to come from textbooks. That might be true for the MPTE, but it's not true for the sports and the other board certifications as well. And really what we like to see more than textbooks is we like to see peer-reviewed journal articles in high-impact journals. And really what we're looking for is journal articles that are really between 2 and 5 years old. That's our sweet spot, because our thought is if it's less than 2 years old, it's too new to really be testable. A lot of people won't really have exposure to that information. If it's older than 5 years, sometimes we say 5 to 10 years, but if it's older than 5 to 10 years, sometimes it's too old, and now we're getting a little bit of historical stuff, unless it's a landmark article. So essentially, we don't want things that are too new, and we don't want things that are too dusty and too old. So the 2 to 5 years is a sweet spot, and we really, if you have more than one reference, that's great. We usually say no more than 3, because it's kind of, once you've done that, you've sort of proven your point. But we like to have at least a couple references from peer-reviewed journals for each question.
Gotcha. No, I agree. I think that is a very good point to bring up, because that is a very common misconception. And, Mike, you had mentioned a lot of this probably throughout the episode already at this time, but I'm going to ask you, because you kind of get to see this exam from a unique perspective, kind of at the top of it, shall we say. And, from your perspective, what do you think are the biggest strengths and limitations of the SCS exam as it stands now?
I've been involved with this exam process for 12 years now. And like I said, I've taken it probably 3 or 4 times, because I helped to develop cut scores and validation. So I know this exam pretty well. The strength is, I think, the information ultimately comes from a wide variety of experts in the field. And it's heavily vetted through that process I mentioned already from those experts. So there's a lot of voices for each singular item. There's been a lot of work to develop the DSP based off the practice analysis, and that DSP is redone every 10 years. So it's not a stagnant document, it actually is redone. So those, I think, are very much the strengths, that you have so much input, you have so many eyes on it, you have so many comments put in it, that it's really, really quite rigorous, and it's a really great validated tool, validated exam. So those are the strengths. So some of the limitations, and I do hear this out from the field quite a bit, one of the biggest limitations, admittedly, is it is a computer-based exam. There is not a lab practical component. So you can be a certified, board certified sports clinical specialist, but there is no lab practical that shows us that you know how to react to an acute injury out on the field, that you could do a correct return to play decision in the moment, that you could adequately do CPR. Now we try to put some safeguards in that we have a requirement of venue coverage, and half of that venue coverage hours has to be done in a contact sport. So our thought there is that you would be more inclined to do those kind of emergent medical care kind of things, as well as you have to be CPR certified and things as well. But there is not that, can this person remove equipment? Can they spine board? Can they do that outside of what we trust to be the CPR model that's going on? So that's the biggest probably criticism we get, is that there's no lab practical component to this exam, that it is strictly a pen and paper, if you will.
Gotcha. So it's kind of like it's more just testing the knowledge aspect of the field rather than the skill component.
Correct.
Yeah.
Correct. Even though our practice analysis, we call them knowledge, skills, and abilities, you are absolutely correct, Brandon, that it really does test the knowledge of those skills and abilities more than the skills and abilities. There is no psychomotor component.
Well, and that kind of feeds in perfectly to the next question. I'm sure this has been talked about for years and years and years, about the possibility or the option of actually making a competency-based assessment for board certification. Do you think that's going to happen, and what are your thoughts on that?
If it is going to happen, it would be down the road for some time. I think what would probably be the more feasible would be requiring residency as a precursor to board certification, which it is not now, though residency will often allow an individual to become more successful when taking the board certification exams. And there had been talk about having that pathway, meaning requiring residency prior to those exams. But right now there's just not enough residencies out there, frankly, to fulfill that. And the need is just tremendous. I mean, the applications, I have some stats from our fall meeting that in 2018, all specialties counted, there were almost 4,000 applications. And now we're well over that. We're into the 4,500, approaching like probably towards the 4,800 applications. So, I mean, it's growing every year. We just see more people applying, more people taking the exams. We see more residencies popping up. They just can't pop up fast enough. If some of the listeners are interested, it would be interesting to note that there are 21,143 board certified specialists overall. And that's really in a pretty short amount of time when we think about everything starting, in the 80s. So really that's quite impressive. And in 2018 alone, there were a little over 2,500 folks certified. So these numbers are just getting really big. So given that, we're probably not inclined at this time to add much more to our current testing process, but the talk will keep going around residency as a precursor for that.
Do you think that given the financial outlook of students and clinicians, that you think that that's feasible from their perspective?
So if I think about that, we have more and more students, I can speak for my organization in particular too, but more and more students that are seeking out residencies. They want to do it on the front end of their career. They want to instill those correct patterns of practice early on. And they also see that the market is getting ever more competitive for physical therapists. I mean, we are still in a great market where our graduates, 100% of our graduates have employment within a short amount of time after graduation. Many of them have job offers even during their final clinical affiliations. But still, they realize that the competition is getting thicker as more PT programs are developed, and they're making their class sizes grow, and they're just pushing out more and more graduates, or sometimes graduating a couple classes per calendar year. And so they want to differentiate themselves from the pack, and they're trying to not only get a job, but get the job they want, get the job that will allow their career ladder to progress and really be differentiated. And so they're looking at ways to do that. Residency is one, and then board certification on the back end of that, or in lieu of that, is the other one. And so I think they see the long-term goals, both for job satisfaction, career progression, and ultimately income, even amidst things such as decreased reimbursement that we're seeing in this climate and things like that. So I think they are looking long-term versus the short-term, like, wow, these tests can be a bit expensive.
I want to go back to that data you had just mentioned, because you had said, obviously, that it's growing exponentially, the number of board certified clinicians. What, from the sports perspective, what do we know about the breakdown? Like, is it mostly residents that are kind of making up SCSs? Like, what's kind of the breakdown of our demographic of who has the SCS right now?
So right now, and I don't have these numbers in front of me, but I do remember that we saw, I think I'm almost correct in this, that 18% of our applicants for sports were graduates of a residency program at this last cycle. So 18%. So there's still a whopping, 82% out there that are the traditional route that haven't gone through residency. Now, this is the part that I would, this is my disclaimer, I may not be entirely correct here, is the question. So are they recent residency graduates, or have they graduated from a residency, say, 5 years ago? We might not be able to pick those ones up. So, but for recent residency graduates, they made up 18%, and that number just keeps climbing. So the percentage of applications within any given specialty area is typically growing as far as the residencies go, and fellowships too.
Sure. And do you guys find that renewals are staying strong too?
They are. They are staying strong. Now, sports, we made some changes, and there's been a couple recent changes. So the maintenance of specialist certification, which requires board certified specialists to show that they're staying current in the field, and they do that on a 3-year recurring cycle, and then the ultimate cycle is a 10-year cycle with a exam at the other end, a 100-question exam at the other end. I think that sort of shook the specialist world a little bit, like, oh, wait, we don't just have to put this little packet together called a professional development portfolio that you guys review. We actually have to like do things every 3 years. We can't wait till that 10th year and then get it all done in a hurry, in a mad dash, and be good. So we can basically sit on our laurels for 9 years and work really hard in that last year. That kind of created a little bit of ruffled feathers, if you will. But I think people are realizing, but isn't that what we want? If you're saying that you're a board certified specialist, you should be keeping up in the field. And so there should be some mechanism to do that. And we have enough folks that are doing that they would love everybody to be held to that standard. And when we look at our medical model, and we look at other healthcare professions in medicine, it's no different than what they're expected to do in that standard of care. So that was one thing that recently came out. The other thing that recently came out that was admittedly creating a little bit of confusion is our new emergency medical responder standards. They used to be called EMR. It's actually called acute management of injury and illness now. And so they're courses that we want people to take to show that they're staying current with things like CPR, spine boarding, concussion management, equipment removal, those kind of things. What we heard from the field were that the courses that historically were offered, were not sport specific, so it was more like courses from the American Red Cross. They were standard CPR courses, things like that. But also that there weren't enough of them, and they weren't geographically convenient for a lot of people. And so our thought was we should open this up to the Con Ed community, because they usually, when they see a need, can fulfill it well. And by doing that, we kind of gave an outline of what we expect these courses to entail. And so we want them to be sports specific. And one of the things, hey, they can still take the American Red Cross course, but there has to be a sports component added into it to fulfill that acute management of injury and illness. And we're starting to see courses crop up. We also decreased the number of CEUs. We made it face-to-face along with some online components for the initial certification. So it's like 7 hours face-to-face and 7 hours in any other format can be online. And then for recertification, we said 7 hours online or face-to-face, but it could be strictly online, was sufficient. Because we realized that if you're in it, then these skills should come naturally, but also recognize the fact that probably a half-day course, even on hands-on, isn't going to be enough to really change practice. And we just really want people to be educated. And we want people to continue to be sports specialists, so we wanted to make things more convenient for them and reward them for that in some way.
Yeah, and Mike, kind of regarding the whole exam process, because as just talking with you and kind of learning how many things that are involved with kind of checking and kind of really ensuring high quality. But from your view, how do you think that this process could be made even better to kind of have it be the best and most up-to-date exam that's possible?
So I would say that the exam is a direct reflection of the quality of the item writers that come in and volunteer their time. And so how can this exam be better? Well, it can only be better by the people that are at the grassroots level to design it and to help create those questions. And so this is sort of my call to action to all you sports folks out there that have waffled saying, do I want to be an item writer? Maybe not. Maybe I should. I'm going to encourage you to. Like I said, I've been doing this for 12 years. I love it. It's a really tight-knit community, and you learn a lot by default. I mean, it helps that there's intrinsic benefits to volunteering, such as some CEU credits and just the professional connections you can make doing that. But it's really comes down to getting really good people that are really invested in the process to do it. And it really is about that. We can do all that we can with our practice analysis and creating the DSPs. But when the rubber meets the road, so to speak, it really comes down to people raising their hand, coming forward, wanting to write those questions, staying and persevering through those question edits so they actually have a good product that they can be proud of. And so it is a great feeling when somebody taps you on the shoulder and says, your question's on the board exam. And it's just there's a sense of pride in that you had an opportunity to be part of this process and help groom kind of the next generation of sports sort of clinical specialists.
Yeah, and Mike, say someone does want to learn more, where would you recommend that they kind of go to raise their hands to at least get involved and start into that process if they want to?
The first place that I would direct them is to the ABPTS website. So that's www.abpts.org. You can click on the sections and click on sports, and it'll take you right to ours, or you can peruse any of the other sections for all the listeners out there that are interested in other sports certifications.
Gotcha. And, Mike, I'm kind of curious because I know, and you kind of mentioned this a little bit with kind of an earlier answer here, but I want to dive in and maybe go a different angle with this. So given this day and age that students have, of course, a lot of debt coming out of school, the reimbursement and such, in your opinion, what is the value of having a sports certification? Like, to you, what does that mean?
So we've done plenty of surveys to ask folks why they do these things. So I can tell you what the survey data says as well. And most of the survey data, it's intrinsic. It's people do these to prove to themselves that they can do it, that they like that identification, that they're a subject matter expert in something, and that happens to be sports, or they have a passion of sports, and so they just can't imagine not growing in that way. So that's kind of the first thing, is the intrinsic value of it is why most people do it. The second reason that I think people would really look at doing the SCS, taking that exam, is because there is another profession, the athletic training profession, that is vying for that same market. And without those proven skill sets that's validated by some exam in some way, like ours, it would be very hard for a physical therapist to be out there with that population when there is another profession that is already working in that purview. And just on the same side is that, athletic training, and I have great friends who are athletic trainers and have good relationship with athletic trainers. They like to define many people, even the recreational person, as a recreational athlete, because they are sort of looking at the same thing. How can we get into a broader market as well? So that helps us sort of get into that market, but also follow our interest paths. There is another reason why some people do pursue the SCS, and that is to get into academia, because you can get into teaching physical therapy if you have a post-professional degree, and usually we define that as a doctorate of education, a doctorate of science, or a PhD. But the other track is to have your entry-level DPT and combine that with a board certification. And so some folks that really want to get into academia will use a board certification as their way to get into academia.
Gotcha. I think that's just really interesting when you kind of basically say that, correct me if I'm wrong, how we kind of have to match up on paper to be able to kind of compete and kind of do it the same level of some other professions. Is that somewhat accurate?
That is somewhat accurate, yes. And the community recognizes and acknowledges that athletic training, that their office, so to speak, is often on the sidelines. And if you ask the community, oftentimes they don't think of a physical therapist's office as kind of being on the sidelines. So when a physical therapist wants to work in that purview, there has to be something that can then showcase to say, I do belong here. I've been trained to be here. I'm not out of my element. I'm in my element.
Of course, knowing that you had mentioned the description of specialty practice as the blueprint for this exam, but apart from what you had kind of mentioned earlier, for someone who perhaps is kind of wondering what's the best resources for this exam, what would you recommend as the top resources for preparing for the SCS exam?
So, Brandon, I'll have to admit that's a little bit of a loaded question. And the reason I say that is because being so invested into this process, all the people that work on this, we actually sign waivers to say we can't really recommend any specific content. What I will say, though, is that there are places that do have resources. So, and I don't endorse any of these, but like there are places like online platforms. You've mentioned MedBridge. There's the American Academy of Sports Physical Therapy. They have some resources. But ultimately, one of the resources that are known and sort of really linked closely with the American Board of Physical Therapy Specialties is that DSP. But as far as specific courses, that is beyond what I'm allowed to say, if I can make that statement.
So, Mike, you'd mentioned a few of these things earlier, but I kind of want to just kind of gather what at least the vision or kind of what are the changes that you see taking place to the SCS exam within the near future and what we can expect.
We are still undergoing some more clarification regarding what courses would be acceptable to meet that acute management of injury and illness. And so we are developing that. We have that on the website. We have more providers coming out of the woodwork from continuing education. And so that's one of our biggest projects right now, is to create a large comprehensive list that will afford our SCS folks the ability to fulfill that compartment. So that's the one thing. And then we're really working hard on the maintenance of specialist certification, at least from an item writing standpoint, because there's an exam at the 10th year of that maintenance of specialist certification process. We are generating more items in preparation for that exam, because now, in addition to creating the standard exam, we got to create questions for that exam. So those are really the big things that are on the plate right now. And in an item bank, the board certification exam is 200 questions, but they really like to see at least double that in the item bank. So that means we're generating questions all the time. We have an annual limit that we can put in of about 125 questions a year, so we can generate that many questions. Something else that I just thought of that I think our listeners would love to hear is that the organization that oversees all of our item banking and test construction is the National Board of Medical Examiners. And the National Board of Medical Examiners, they're headquartered out in Philadelphia, so it's actually pretty close to me here in central Pennsylvania. They run that same board certification kind of structure for over 200 professions. So the same, if you're an anesthesiologist, if you're a podiatrist, their board certification exams often come through that same entity. So these are to I'm saying this to challenge the folks to say, well, I don't really believe this test is a good representation of what, sports physical therapists may or may not know, or just whatever criticism they may have of that. Is we are under the same umbrella. So essentially, if you're criticizing the ABPTS examination process, it's the same process that all those healthcare folks that have board certifications go through. So I think that knowledge isn't out there, but I like to make that well known.
No, and I appreciate you sharing that, because I think that gives good perspective on that. And, Mike, we've talked a lot about this exam and ABPTS, but now I'm going to kind of switch gears a little bit and kind of have you put on your academic, but also just your general sports PT hat on now. If we can just kind of get away from post-professional and start talking about more entry-level education. So I've got to ask, of course, with kind of knowing that, of course, how much schools have to cover within a finite amount of time within the curriculum and such, and the NPTE as well. Do you think that we need more sports content on the NPTE and in entry-level curriculum?
Well, I'm extremely biased, Brandon, so I would absolutely say yes. But I think the real rationale for that is we are seeing youth sports growing like almost no other demographic. And so when we graduate our PT students, they're going to interact with these youth athletes, and they have to have some concept of how to deal with injury mitigation, performance enhancement, injury risk evaluation, all those different things, return to play decisions, even if they're not on the sidelines. And so I absolutely think that we should have more information or testing on the licensure exam, because that's going to be an expectation. Now, what does that mean? That means that educational programs, DPT entry-level programs, need to embed that coursework into that. Right now, a lot of programs have sports as an elective, not as a requirement. So if we can push down some of that information and make that required, then we'll really start to see that change. And really, what drives DPT programs to add content or to take content out, it's really our accrediting body of CAPTE, the Commission Accreditation of Physical Therapy Education. And so if there's a change at that front, then we'll start to see a change within the curriculum. We saw that with another one of my passions, manual therapy, so hands-on care, and we started to see things change pretty rapidly once they were very specific about what had to be included in the entry-level curriculum.
Gotcha. And Mike, to your knowledge, is that discussion within CAPTE been brought up or is happening right now, to your knowledge?
To my knowledge, I don't know. I don't have that knowledge. I don't have that insight, but I would love if even this conversation we're having would spurn that discussion on that greater level.
No, indeed. And, Mike, I'm just kind of curious, because I recognize that some people out there maybe aren't aware of the specific requirements regarding sports as it is right now within CAPTE. What are the current standards say in regards to sports?
So really they break down what an athlete has to do as far as movement patterns. So, and it's kind of just, I would say, somewhat general, and they just talk really from an orthopedic standpoint about what an injured person looks like, whether that person is an athlete or not. But when it comes to really sports-specific things, and that's the other question we always get on the what's the difference between sports and orthopedics? And I sort of say, well, what's the difference of you standing on the sideline and you standing in a typical outpatient orthopedic clinic? That kind of might give you a sense of what the difference there may be. But it's really, CAPTE has acknowledged what kind of content should be in there, really from more of an orthopedic standpoint. And then it's up to the programs to translate that knowledge into sports.
Gotcha. No, that makes a lot of sense. And actually, my alma mater, they didn't, from my knowledge, what they basically did was they actually created a sports mentorship program, which is an elective. But basically, a certain number of students are able to just really dive into different avenues within sports, talking about research, return to play, and some of that stuff. So I'm seeing actually a couple of schools do that, throughout the country.
Some are starting to attach residency programs to their academic institutions. And so I love all of that innovative way to get the sports content out to the new grads.
No, absolutely. And Mike, this has been a really good discussion, and I feel like I've learned a ton regarding the sports exam and just sports in general. And I really appreciate your insight on that, as I know the listeners do as well. But, of course, it wouldn't be a podcast episode if we didn't finish with our big finale. So if you want to say something that you've either mentioned already tonight or something different, please feel free. Sky's the limit on this one.
All right, great. One of the things that I really think about when I think about sports physical therapy and just physical therapy in general is, I think one of the biggest issues is the lack of standardization of care. And I think you've probably heard this from multiple folks that have come on here and talked to you and shared this with your listeners. But I think standardization of care in the profession, as well as standardization of education, really needs to happen. Because when I think of the SCS and I think of other board certifications and what that can do for folks, at this point in time when reimbursement and payments starting to be pulled back a little bit, I think, is there going to be a time where they're going to reimburse somebody more if they have a board certification than if they don't? So kind of the insurance companies recognizing maybe that tested, proven on an exam knowledge. And I want to say it that way because there's plenty of physical therapists out there that are wise and expert beyond their years that just have elected not to take these exams. But I just wonder if there's a point in time that they will ever reimburse at a higher rate for those things. The other thing that I really want from physical therapy, at least from a healthcare standpoint, insurance standpoint, would be, I'd really love for them to reimburse in line with what the evidence is showing us. And so really start rewarding folks for using the highest level of evidence and those type of interventions. So you gave me sky's the limit. That's my really grand picture. And again, I'm in academia and I'm currently sitting in a program director role. And so what I want for all my students is really be great to be rewarded for doing the best thing that we know by the evidence that we have and being paid accordingly to that. One thing I always tell my students, I said, on the whole, I think our students often undervalue their services. We are very, very valuable within society, and sometimes we can be our own worst enemy as far as what we think of our own value and how much that the system should repay us for the things that we do. So that's sort of my soapbox.
That's interesting. It's been interesting because I know that's something that, we've thought about as well. And I guess the big thing about that, of course, before any kind of payer goes to that, is my immediate thought is there's probably got to be some evidence that really kind of shows there's kind of a big difference for that. And I know that, APTA and ABPTS and that they're collecting a lot of data right now and with the outcomes registry. And I know that's got to still a while to really get a lot of data to really say anything conclusive. But one thing I will say is that ABPTS, and from my understanding, ABPTS has basically offered, if people are wanting to do research in certain things, they are willing, they are open to negotiating, potentially sharing what they have to get some more research out there. So I think it'll be interesting to see what the results of that are.
I agree, Brandon. I think we're at the point now that we have enough specialists out there, that we have enough folks that we should be doing research and we should be testing. And if there is really no difference in outcomes, no difference in the quality of care between a board certified specialist and that person that's not, and I would be a little bit surprised if that were true, but if there is truly no difference, then we need to acknowledge that as well and move on. But I think we're at the crossroads where that data needs to be collected.
Right, because we really don't have a lot of information now. There's of course the Rodriguero study, which of course looks at residency and fellowship with outcomes. And while yes, that message was kind of clear with that, there's also some pretty strong limitations with that we can't make that generalizable just on one study. So it'll be interesting to see kind of how we look at outcomes with that as well, because of course you had said there was that study with I know Greg Hartley and then a few others. Yeah, they kind of had done the study looking at residency, then with relation to board certification, which was very interesting indeed. Mm-hmm. But then I think it's taking it that next level to now, how does it affect outcomes? How does it affect like the actual patients?
Yeah, I agree. And we need some sort of qualification of what type of patients these folks see. So, it wouldn't be an apples to apples comparison if folks with the board certification are the people in their organization that tend to see or get more complex patients put on their schedule versus somebody with less complex patients. And so there's a lot of research availability out there. There's a lot of things yet to study. So I'm really excited at what the future decades hold for our profession and for board certification.
Likewise, it'll be very interesting to see. And well, Mike, again, thanks so much for your insight with everything. It's been really great. You had mentioned, of course, the ABPTS website earlier, but where can people kind of reach out should they have a follow-up question regarding kind of what we talked about today?
Probably the best way to reach me is by email, and it would be mike@pearlmanualtherapy.com. So you can always reach me at mike@pearlmanualtherapy.com. As I said, my other passion besides sports medicine is manual therapy. So I do a lot of speaking on that and differential diagnosis. I just can't keep to just one small wheelhouse, I guess. But so that's where they can reach me. I would love to answer any questions. And always, if you can't find that email, you can reach out directly to the Sports Specialty Council, and I'll be on there for a while longer. And so we can help answer any of your sports related questions as in regards to board certification.
Well, perfect, Mike. And again, thanks so much for coming on this evening, for sharing your insight onto this. It's been a true pleasure.
Yeah, thank you so much, Brandon. I really enjoy spending time with you, kind of sharing with the listeners my experience, and it's been great. And I hope to see more folks raise their hand and join the item writing team, and we'll see out at CSM if that is something that you want to take on.
For sure. And listeners, if you are kind of curious there, I put the links in the show notes to kind of what Mike was mentioning earlier with the website and such. So if you're on your phone, feel free to just scroll down, or if you're on your computer, check it out on your phone or on the website, because those links are there. Well, Mike, again, thanks so much for coming on.
Thank you so much again for having me. I appreciate it.
Access to healthcare is one of the largest issues facing both providers and patients, as millions of people worldwide lack timely and affordable access to healthcare. Anywhere Healthcare, a telehealth platform, is a simple, low-cost option for providers and patients that eliminates the barriers to access to all kinds of healthcare. To find out more, check out anywhere.healthcare, which is available in our show notes. And if you use the code HET in all caps when you email to sign up, you'll save 25% off the total cost. Thank you for attending class today, and we hope that you learned something and gained value from the content.
If you'd like to schedule office hours with us, feel free to add us on Twitter at HET Podcast, on Instagram, HET Podcast, on Facebook, the Healthcare Education Transformation Podcast, and the homepage, healthcareeducationtransformationpodcast.com.
And for those of you following along in the syllabus, extra credit can be obtained by liking us, sharing us, and leaving a review.
Let's continue our journey up Mount Educational Success as lifelong learners.